Because we have spinal muscular atrophy, last stage of Parkinson's. Our clinic is up to night 2 o'clock. So we'll start today with question answers. I want to know what you want to know. Always I teach you. Now I want to know what you want to know, so that I can prepare the class according to you. तो आप वो पूछिए जो आप जानना चाहते हैं. क्या जानना चाहते हैं? What you want to know from me? You're spending money, you're spending time, you're spending so many things. So I want to know what you want to know.
Sir, should I start, sir?
Yes, you should start asking questions.
Good evening, sir. Myself from India, B.S. Uma Maheshwar Raj.
Yes.
Sir, we want to learn various techniques by means we can treat the patient.
In the revision class or you are only in the fellowship class?
Fellowship, tomorrow I'm interested to personally meet and join the course, sir. I'm staying in Hyderabad only.
You want to meet me tomorrow?
Yes, sir.
Welcome.
Thank you, sir.
Bring some good idlis. I have not eaten good idlis from a long time.
Okay, sir. Veg or non-veg?
I'm already too much frustrated after so many patients. I want to eat some good food. Bring me good sambar.
Sambar, okay, sir.
Yeah, sambar. I want some sambar. You tell your wife to make some good sambar for me.
Yes, sir. Do you prefer veg or non-veg, sir?
I'm a pure vegetarian. Sastri.
Yes, sir.
So bring me some good sambar.
Okay, sir. I will bring.
Then I will speak to you. If you cannot bring me sambar, don't speak to me.
No. Thank you, sir.
Now ask me your questions.
I want to learn all the techniques by which means we can extend
all the techniques. See, one thing I tell you. Technique depends on the conditions of the patient. इनका सवाल है कि मैं सही टेक्निक सीखना चाहता हूँ. I know by now I have developed more than 15,000 techniques of acupuncture.
Yes.
Can you learn 15,000 techniques of acupuncture?
No, sir. Mainly those techniques which are immediately giving pain relieving.
See, now the question is, relief is 1 and recovery is 2. Third is maintenance. So what we learn in medication is what? Maintenance. And in physiotherapy also we learn maintenance and little of recovery.
Yes.
How people recover is a big question.
सर आपकी आवाज कम आ रही है.
अब आ रही है बेटा? हम लोग क्या ना अभी तक पूरे थक जाते हैं एकदम.
नहीं, वो नेट का सर, उनका नेट का प्रॉब्लम होगा. मुझे तो बराबर क्लियर दिखाई दे रहा है.
क्लियर है सर.
एक्चुअली क्या ना रात तक बड़ा गुस्सा जम जाता है. 150-125 पेशेंट देखने के बाद क्या होगा आपका दिमाग? देखना तो दूर, प्रोसीजर्स करते हैं ना. We do number of procedures. This is what our expertise means. You understand in a week how much 800-900 patients we see of the same category, same type of patients, and every day we see the same improvement. But every day before doing any procedure, you know what do I do? इन्होंने मुझे एक सवाल पूछा कि मैं मेन टेक्निक सीखना चाहता हूँ. मेन टेक्निक में इन्होंने मुझे पूछा पेन रिलीफ. तो मैंने बोला देखो पेन रिलीफ कैन बी डन बाय एनीथिंग. आप कान में 5 नीडल मार दो तो भी पेन रिलीफ हो जाएगा. यहाँ में 2 नीडल मार दो तो भी पेन रिलीफ हो जाएगा. यू पुट 5 needles over here. Forget about 5. You put just 2 needles over here. There's the vagus nerve. Your whole body pain is gone. What is pain?
Body's response.
Now see, the classification of pain. Is it a stabbing pain? Neurogenic pain? Write down. Stabbing, neurogenic, neuropathic, neurocondition. यानी नसों का दर्द जो कमर से आता है, इम्पिचमेंट, नस बर्बाद होने से होता है, न्यूरोपैथिक, डीजेनरेशन मतलब वही डीजेनरेट होते जा रहा है, खराब होते जा रहा है, और एक होता बर्बाद. Aditya Khare, are you in the class? I have a vacancy for an acupuncturist in my clinic. Anyone want to join?
Yes, sir.
What is your qualification?
I'm Air Force trained medical assistant.
No, sir. We
Sir?
cannot. We can keep you as an assistant, but not as because as per the norms we need BMS, BHMS, BYMS, like this.
This Maharashtra Acupuncture
No,
Council
then
examination place.
that is valid in Maharashtra. Telangana Council, Telangana government will not accept it.
But as on date, we don't have any council, no, sir.
No, no, no. See, the question is that whenever you practice in an organization, when you do individual, you're individually responsible. When you work in organization, you have to submit all the documents to whom? To the government for verification. Recently, a person gave a police complaint against me. I told you, na, before suicide.
No.
IGP immediately submitted my documents, certificates, and my profile, Facebook profile, to whom? To the police inspector. Right?
Yes, sir.
Immediately, the complaint was what? The complaint was, I am a fake acupuncturist, and immediately that complaint was withdrawn. So you can come here to learn. See, I can teach you. But only if you want to really learn. Don't come for time pass. Don't come to kill your time and hear my lectures. Those who are really interested to recover the patient, जो really मतलब जिसको एक चाहत है कि मैं कुछ करूं, वो एक उत्साह होना होगा मन में. That enthusiasm has to be there in your mind. That yes, we can do it because it's fun, it's enjoyment to see 0 to 10. Patient has come 0, now it's 10. That each level of recovery should be enjoyment in your mind. हर लेवल ऑफ रिकवरी आप जो अचीव करके लाते हैं, इतनी मेहनत करके लाते हैं, वो एक इंजॉयमेंट होना चाहिए, एक फन होना चाहिए, एक मजा आना चाहिए. That fun can be only enjoyed when you really like to do something. Putting needles and getting no result is failure of the subject. Writing medicines and getting no result is a failure of the subject. You know, other day Dr. Avinash, who's my colleague, I asked him, what can you do with Jagan syndrome? He said, I can only explain and I can give you a best therapy, which costs around 12 lakhs. But then, if you ask me, I recovered the Jagan. I recover spinal muscular atrophy where 16 million billion crore Indian currency, I don't know how much comes in, 5 million Singaporean dollars are required. We have recovered the disease with what? Our own developed stem cells, our own developed process of stimulations. So what I am speaking here, sitting and speaking here is my experience with how I deal with these cases. These things are not written in book. I've read all these books. Tell me which books you have written and research paper has written spinal muscular atrophy can be recovered. कौन सी किताब है जो बताती है कि ये बीमारियों का इलाज होता है? आपके कल आंख के सामने एक स्लिप डिस्क पेशेंट का ट्रीटमेंट हुआ. I treated a slip disc patient whose disc was extruded, who visited 5 neurosurgeons, and then out of 5, he selected me. Because I was the one who gave him instant relief near you, publicly. The patient may deteriorate also. He may go to the stage of shock, but my experience says no. So what do you want first? That you have to decide. So how many of you all want to run about retinitis pigmentosa? How to recover the eyes? How many of you want to work with pain management? How many want to work with microvascular acupuncture techniques? You must learn how to work with a slit lamp first. What is slit lamp? Indirect ophthalmoscope. How to use ophthalmoscope like this? Oh, Amadi's son, huh? Amadi grandson, what is his name?
My granddaughter.
What is her name? What is her name?
Naila.
Naila. Hi, Naila.
Bye.
Hi.
Bye.
She also so interested to learn. See, our youngest student of the class. Welcome to the class, Naila. See, she's very attentive. See, her eyes, very attentive. She's more attentive than Amadi. Amadi is looking here and there. Naila is only looking to me. Best student of the class, Naila. Agreed or not? Vinny?
Yeah, Naila. Naila.
Do you agree with me? Best student of the class is Naila. Amadi's granddaughter. You see how attentively she is looking me? Anyway. So, we must understand what is our intention of learning the techniques. One is technique, one is procedure. So techniques, write down 2 things. See, don't learn from my slides, learn from me. I don't like teaching from slides. They have limited knowledge. We have unlimited knowledge because we work on the table. By now, I've dealt with more than 100 patients. So, 2 things you must understand. One is technique, one is procedure. Write down. Technique and procedure. Procedure means what? A method by which everything is visualized in your brain. 2 चीज होती है, एक होता है टेक्निक, एक होता है प्रोसीजर. प्रोसीजर का मतलब होता है समथिंग विच यू हैव विजुअलाइज्ड, मतलब पूरा आपके आंखों के अंदर सब कुछ आ गया. बीमारी क्या है, क्या नहीं है, अंदर के अंदर क्या है, और आप किस तरह से अंदर जाना है और किस तरह से बाहर आना है. हाउ टू गो इनसाइड एंड हाउ टू कम आउटसाइड. This is the best thing what we must understand. There are 2 classifications, what technique and procedures. So what do? You want to say, I want to learn techniques. See, techniques cannot recover the patient. You must learn procedures. What procedure, which procedure has to be applied to recover a patient? Breaking needle to the points will not recover the needle. Today I saw one of my junior. There was a fourth ventricle tumor, post-operative case of post-ventricle tumor, and he was just stimulating like this. I said, "What are you doing?" I'm stimulating the quadritum lumborum. I asked him, "Did you study the anatomy of the brain? Which area of the brain is damaged?" His cerebellum was damaged. But how to revive the cerebellum? Did you ever study? सेरिबेलम यानी पीछे वाला हिस्सा ब्रेन का जो फाइन मूवमेंट्स देता है, जो कोऑर्डिनेशन देता है, वो खराब हुआ है. क्या आपने उसको ठीक करने की एक बार भी कोशिश की? तो ये बात समझना होगा, क्या चाहते हैं आप, प्रोसीजर और टेक्निक.
So need to learn some fundamentals.
So what is fundamental? First
So
define what you mean by fundamental. What is the dictionary definition of fundamental?
like
No.
muscle.
Go to dictionary and say what is fundamental. Don't give me your definition. What is fundamental?
So disease pathophysiology is a kind of thing. Second thing, how it will proceed and how we can revert to its normal activities.
No. What is the definition of fundamental?
Fundamental are the basic things which we can
Is it your definition or dictionary definition?
dictionary definition nahi hai, sir. It's not a dictionary definition.
I'm asking you what is dictionary definition?
I have to see sir the fundamentals.
You see it first. You have patience. You see once. First, your basic things should be clear. What do we
Forming a necessary base or core of central importance.
Yes. Word of central importance. The roots of the tree must be strong. Now tell me, how many of you who are present in the class, roots are strong? Whose roots are strong? So to understand things, fundamentals, procedures, techniques, you must go by series of what? Processes. Right? You must go by series of
Processes.
process. Now, may I ask you one question?
Sure, sir.
You are in my fellowship group.
Yes, sir.
How many people did you motivate by writing a paragraph?
Never did it earlier, but
No. How many did you write what you have learned? You write in the WhatsApp group what you have learned and understood.
एक्सक्यूज मी सर,
हाँ
सर आवाज बहुत कम आ रही है सर, सुनाई नहीं दे रहा।
अब ठीक है?
हाँ जी सर, ठीक है।
Yes, sir. Thank you, sir.
सी, कोई भी चीज को समझने के लिए उसके गुण रहस्य और गुण तत्वों को समझना पड़ता है। व्हाट इज ए डिजीज, प्रिंसिपल्स ऑफ डिजीज, क्लासिफिकेशन ऑफ डिजीज, ग्रेडिंग ऑफ डिजीज एंड अंडरस्टैंडिंग ऑफ डिजीज। व्हाट डिड यू अंडरस्टैंड? Classification, variation, then ask more questions.
Sir, in my case, I am having little knowledge about the acupuncture procedures. Though I attended number of courses, but practically I am not exposed much. So, with your experience, enormous knowledge, you decide which is the best way to cover step by step and inculcate the complete field, so that with a shortest time, I can start treating little cases, and side by side I gain knowledge and distribute the knowledge to other colleagues also.
So you must understand what you want to learn. पहले ये तो जानो आपको क्या सीखना है। पॉइंट 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 पॉइंट। आज तक कोई आदमी पॉइंट से रिकवर हुआ है? दर्द कम हो सकता है, रिकवर तो नहीं हुआ। ट्राई टू रिकवर द डिजीज। Then from one principle to 10 principles, we learn.
हेलो हेलो, क्या हुआ सर?
Sir, bangun sir, jangan bobo.
थोड़ा सा वो हो गया, क्या बोलते ड्राउजी हो गया, कोई बात नहीं। एक्चुअली क्या थकान, बिकॉज एक साथ 100 पेशेंट लगातार आप देखते रहो, एक के बाद एक के बाद एक के बाद प्रोसीजर करते रहो, क्लास लेते लेते नींद थोड़ी सी आ ही जाती है। उठा दिया करो थोड़ा सा, मेक मी वेक अप, आई एम गुड
इसलिए
इनफ।
सर, इसलिए मैंने बोला।
अच्छा क्या प्रकाश जी, थोड़ा उठा दिया करो, हाँ, अलर्ट हो जाता है। हाँ, ask me questions please. See, we'll go for first 5-10 days, we'll go for question answers. पहले अपने मन की विचारों को क्लियर करो, first clear your doubts before learning, before going to any process of learning, because learning is a long process. Whether you should learn or not, that you have to decide. You should decide like Amadi. Amadi came to me 4 years back. Still Amadi is with me, like my own friend, like my own brother. You know, the cremation of my mother, which pyre of the wood was given by Amadis, and it came from Singapore. I'm the happiest person in this world. I said, finally, my mother was cremated by the contribution of my student, not by me. Me and my students are one today. Not a single person came and said me anything, only writing Facebook. But I'm very happy from the Singapore. They came and I was very happy. The wood which we give on the fire was given from the Singaporean currency. And I'm very happy that my final journey was gone from my center. And cremation was done with Singaporean students. We followed the Catholic, the Chinese culture, that the cremation is to be done by the friends and relatives. I had no friends and relatives who came ahead, but my Singaporean students, they donated exactly 27,000 rupees, which was used for the cremation of my mother. And I'm very happy that you all are my students. I'll never forget that 27,000 rupees which I received from Singapore. Anyway, that's what the memory remains. This is how is called a technique and a procedure. Technique means what? You just did something, patient got instant relief. Procedure means what? The recovery of the patient. Procedure, series of sets of things, A, B, C, D, E, F, G, if Y, you will not get results. Technique means what? You inserted in result like tongue. Because I'm going to teach you tongue acupuncture, orthopedics and all. मेरी स्लाइड्स रेडी रखिएगा प्रकाश जी, तुम की मेरे पास तो कहाँ खोजूं मैं, आपके
क्या
पास
क्या
है
क्या, कौन सी?
तुम की? अभी नहीं, आज नहीं, हम लोग टुंग से चालू करेंगे क्लास. I'll teach tongue orthopedics, tongue neurology, tongue, because tongue, when I practice tongue with NIBS, when I practice tongue with many things, tongue was the acupuncture technique which is one of the authentic technique.
हाँ सर, मैं
Because
भेज
it
दूंगा
speaks of
आपको।
reaction of the brain, reaction area of the nerve. वो अभी नहीं, आज नहीं, आगे
जब आप
5-7
बोलेंगे
दिन,
तो भेज दूंगा।
5-7 दिन बच्चों से बात करने दो, पहले उनको क्या सीखना है. पहले देखिए, कॉलेज में हम लोग जब जाते हैं तो 5-10 दिन ये किताबें खोल के चालू नहीं हो जाते, ये एनाटॉमी है, ये फिजियोलॉजी है, ये ऐसा पढ़ो, भाग जाएंगे बच्चे. पहले उनको ये समझाओ कि क्या क्या करने जा रहे हो, आप उस लायक हो या नहीं हो, आपका इंटरेस्ट कितना है. 10 दिन पढ़ेंगे फिर भाग जाएंगे, फिर बोलेंगे मेरे पैसे रिफंड करो, फिर बोलेंगे ये करो वो करो. इससे पहले फर्स्ट यू डिसाइड what you want and what you want to ask me, whether I am a competent teacher or a non-competent teacher. That is, you have to decide by asking questions. So carry on by asking questions. Procedure means what? One done surgery is one procedure. Doing dressing and everything is the second part. Medication is the third part. Fourth part, each part has been successfully done or not. And ultimately, the wound has been healed or not. And fifth, whether the patient can walk or not after neurosurgery. If the patient is not able to walk, your whole procedure is failure. You just saved his life, but the procedure is failure. So technique is what? Just putting something to reduce the pain. It's just like giving a paracetamol of 500 milligram and reducing the pain. And technique means once this, and procedure means what? Recovery of the patient. Today I got one autistic child of 25 years. The mother was so pampered that she did not even, she thinks that everything should be done like this, like that, like this. And she was so anxious that I thought it is better not to treat that child. And now she is facing the aggressiveness of our own child. That is our punishment. I can recover the child in 10 days, 15 days. How much days I will take? But the behavior of the mother, the approach of the mother made me so over concerned that I said, it's better to leave up this patient. Giving up patient is their problem. Patient का ट्रीटमेंट नहीं हो रहा, पेशेंट सर्जरी में जा रहा, पोस्ट कॉम्प्लिकेशन में जा रहा, पेशेंट मर रहा है, वो उसकी मुसीबत है, आपकी नहीं है. Because you deteriorated the patient, not me. So you must understand one thing. We can help people, we cannot recover people. God can recover, but our procedures must be good. People come to learn techniques from an expert. People must come and learn procedures from me, how I recover patients. People want slides, people want my book. I've just completed my book, how I recovered the complicated cases of neurology. What do people say? I want a copy of it. Oh, I said it is not for sale. I've written that book out of my blood. Day and night I've spent just writing in beautiful words. Everyone writes me a beautiful word. But those इंडिया में बोलते हैं नॉलेज उसी को मिलती है जो छात्र क्लास में बैठकर सुनने से आपके अंदर वो पात्रता नहीं आएगी. Knowledge will only come to you when you can recover patience. 1 minute, let me complete when I speak, let me complete. Then you speak. I'll give you a chance to speak. So, you must differentiate between two things, knowledge and expertise. Write down. These are the basic things which you must understand when you learn. Knowledge and expertise. Expertise will come when you will see the real recovery of the patient. Knowledge will come every day. Everything you are learning every day from book, this paper, that paper, IP-Cherian, this. You learn everything. But can you become IP-Cherian? Did you become an expert? I only see what you write as a feedback in Facebook, as YouTube. I 145 students, I just see. And then I decide, this is the level of your knowledge. 90% of the people, they don't afford to do anything. 10%, they try, but they fail. So we see in neuro cases and ortho cases, basically neuro cases, we see 85% failure. How much? How much failure is there?
85%, sir.
85%,
Yes.
sir.
Less than 15% is success and 85% is failure. Not because the neurosurgeon has not done his work correctly, but because you also did not do your work correctly. You've never studied correctly. You don't know ABCD of the procedures. So what happened? You cannot recover a patient. You give me a patient, any patient, I enjoy. The more the critical, the more I enjoy. I always say, अरे 3-4 spine तोड़ के लाओ साला, क्या एक spine तोड़ के लाता है? But then the patient comes. My physiotherapist last night was saying, sir, I'm having tachycardia. I told the patient is not able to lock the knee. What will happen to me? I said, are you a physiotherapist? Do you think a spinal cord injury, a greatest wound with transaction injury can recover in 1 month? What kind of counseling are you doing? First, understand what is a disease. Disease उस बीमारी के बारे में पढ़ो. First, समझो how it is going, how it will progress, to what grade it will reach, and how the patient will die with this disease. Just from the beginning to the death of the patient with the disease, you must know. Then you will be able to reverse the part of the disease. You are trying to reverse the part of the disease. When I was speaking about diabetes, I had 770 sugar. But when I knew about it, I studied about it, I changed my diet, I stimulated my beta cells, my sugar immediately came down to what? I'm a non-diabetic now. From last 7 months, my HbA1c comes 5.
Nice, sir.
Yes, it is always nice. I learned a new method how to recover diabetes. I use it. But can I teach you? No. Are you prepared? No. Are the fundamentals clear about pancreas? Are the fundamentals clear about the digestion of the food? You only want to know point. There is no point in the world, my child. Everything is a point. Your interest in study will only make you see a simple paper, cleaning and cooling of brain. एक छोटा सा कागज, cleaning and cooling of the brain. Change the entire mindset of the whole world. G lymphatic system has changed the entire mindset of 100 years neurology. One research paper has changed 100 years neurology. Now we are in a position, even in my center, I recover Parkinson's patient. What was my opinion earlier? Before meeting Parkinson's, no, Parkinson cannot be cured. Better not to touch them. Now I enjoy with all stages of Parkinson's. I know I cannot cure them, but I will fight till I cannot recover them.
Hello.
Yes, I can hear you. Tell me your question. पूछिए क्या पूछना है? पहले सवाल जवाब कीजिए. Ask me questions first.
Excuse me, sir.
Yes, please tell me your introduction, sir.
Sir, I am from Visakhapatnam. My name is Rajbabu.
Rajbabu, what is your profession, Rajbabu?
Acupuncturist, sir. Master tongue and scalp auricular therapy करते sir.
Acha, in master tongue, what is, can I ask you one question?
Yes, sir.
What is tongue diagnosis? Not tongue, master tongue diagnosis. How it is done?
Based on the disease, sir.
Who taught you this? Based on the disease, the tongue diagnosis is done. Which book, which
Patient
page?
could.
Patient is
Yes,
suffering
sir.
from a disease. Master tongue has written a procedure in which a diagnosis pattern is developed, right?
Mm.
Am I correct?
Yes, sir.
Who taught you this? That based on the disease, points are selected.
Nobody, sir.
You developed your own concept now.
Yes, sir.
This was very wrong. It is developed from the palm. It's called
Yes, sir.
Palmer diagnosis. Write it down.
Okay.
Now, what is auricular acupuncture? Tell me. What do you mean by auricular acupuncture? What did you study in auricular?
Auricular acupuncture में
ER
How
mapping,
does
sir.
auricular acupuncture recovers a patient? Tell me.
Whole body is representing in the auricular.
Don't tell me this bullshit answers. Whole body cannot be represented in the auricular way. A part of the vagus nerve. Whole body can be only represented where? In the brain.
yes, sir.
Brain is the one which functions the whole body. You see neuroanatomy? एनाटॉमी खोल के देखिए, आपको पता चलेगा सारा काम ब्रेन से होता है, कान से नहीं। कान उस एरिया को स्टिमुलेट करता है जिससे वो एंडोफिन्स, एसिटोलिन, डोपामिन, न्यूरोट्रांसमीटर्स रिलीज होते हैं जो उस दर्द को कम
जी।
कर देते हैं। एंड दैट इज व्हाट आई सेड, ब्रेन। नाउ यू अंडरस्टूड हाउ मच रॉन्ग यू हैव स्टडीड?
Yes, sir.
Did you ever study about the Palmer diagnosis of tongue?
No.
Okay. Now tell me on what is the basis of your tongue point selection? How do you select points on tongue? And what are the methods of kneeling in tongue? Don't worry. If you ask questions, then all your doubts will clear. I don't know you, no one knows you. It's just a discussion. My voice is little rude, don't worry about it. I'm not rude.
Yes.
Voice is only like that. After dealing
No
with patients,
problem.
we become like that. Don't get annoyed
Yes,
with
sir.
my voice. Okay? मेरी
Yes,
आवाज से
sir.
आप
Yes.
नाराज मत होइए। हम लोग 100 पेशेंट देख के आते तो ऐसी आवाज हो जाती है, सिस्टर्स पर चिल्लाना, इस पर चिल्लाना,
Yes,
वो
sir.
दो, ये दो, ऐसा दो, तो वो एक टोन हो गया हमारी आवाज का। This is how we speak. The way you speak, we also speak like this. This is our tone of
Yes,
speaking,
sir.
right? Let us discuss something about
Ji,
master
sir.
tongue. How do you select points on master tongue? What are the primary things of tongue point selection?
Color, sir.
Ji.
What color? Which color?
White, yellow.
It is not in tongue.
According to
No, it is not in tongue. Which book
No,
of
sir.
tongue you have read? Young, Wang, Mariam Lee. I have written a book on tongue. I am the first Indian author to write book and teach tongue in India. I have read all things, not even in a single page of tongue. Yellow, red, green. Which book?
No, sir.
You are saying something colors are to ask. Talk to me.
Sir,
I'll clarify his
sir.
concept.
Sir, according to I don't know, sir. I have
Who
read,
taught you? First, what color? What color you are speaking of?
sir, according to disease severity or something like that, sir. Acute or chronic.
My dear, you are confused with two things. What are they? Since you did not study tongue properly, you did not understood what is tongue. There are two parts of tongue. What did Master Tongue said? Write down. If your diagnosis is correct, if your diagnosis is correct, if the depth of needling is correct, if the reaction area is correct, you will instantly get results. This is what Tung said. Bring them there. Build Business is just copy of such books of Wechi Young and all. He did not write a fundamental book. The direct disciple of Master Tung was Wechi Young, not Wang. Wang was the real disciple. So when you read the book of Wang and Wechi Young, you'll find these things. Mariam Lee was again not the class disciple. She was actually, when you speak about Master Tung, he did this practice as well in Second World War, large number of patients. Number one. His name was the first author of Master Tung was Belden Carson. He was a Tibetan person who later on changed his name. Master Tung never liked Chinese people, so he never taught Chinese people. But Mariam Lee has read from one of his classmates. She was not the direct disciple, which was taught by Belden Carson. His real name I forgot, but he's a Tibetan person. He was the first author of Tung acupuncture book. I have read that book with me. The original book was written by Belden Carson, in which he used to say, Master Tung used to put the points and never used to explain it. And you explain the chart and used to go away. Used to see, tell his students, first observe, think, understand and realize. यानी मास्टर तुम कभी नहीं बोलते थे कि मैंने ये किया, इससे ये हुआ. पहले देखो क्या किया मैंने, फिर उस पर विचार करो. क्या हुआ उससे क्या फायदा हुआ, उस फायदे को समझो और कितने दिन तक वो फायदा रहा. So for pain management, Master Tung is excellent. But for pain treatment, you need procedures. Write down. Master Tung teaches pain management. What does Master Tung teaches? Instant pain management. Instant pain management. Not the procedures to recover the patient. A procedure means was a systematic way which you have to pre-plan in which way you have to go. For example, I have to go to Malaysia, I have to plan. First I have to go to Kolkata to Malaysia, Malaysia to Kuala Lumpur. It's a planned way. That planning is important, my children. What you practice is just what? Someone told you the whole year is written, these books are written. Those things cannot be applied in modern medical world. We are dealing with modern medical world where you have to give a clear scientific explanation of what you are doing. A part of the vagus nerve which touches the body. Vagus nerve is the biggest nerve. And with the help of vagus nerve stimulations, which is in the ear, you recover the patient. Don't recover, you relieve the patient. Sometimes you recover because once you stimulate, the brain recovers the deficiency for which the disease was created. It is not the auricular acupuncture which it was a signal which was given to the brain that recovered. Auricular acupuncture से आदमी recover नहीं हुआ. आपने यहाँ से जो needle लगाया, उस brain में जो signal गया, उसे जो processing हुआ, उसके बाद वो उस area को जो deficiency था, उसको वो मिला, तब जाके patient recover हुआ. तो auricular acupuncture is a part of explaining things in a holographic way. क्यों? आप उस part को पूरे. If you read Suven, Yellow Empire book of written by Oswald, you will understand what Macosia, what that many things have been made simple for you. कि यहाँ इंटर लगा देने से ये हो जाता है, just to simplify it. But real method is you are sending a signal to the brain in a proper way. So you must know how to send signals to the brain so that target drug delivery is done. What it is called?
Targeted delivery.
Target drug delivery. Yes. You have a knee pain, you put some needles here, and immediately the knee pain should go away because it is called target drug delivery. TDD. Understood? This is how you learn by asking questions. You clarify your doubt first, and then you will know where you are. First, you must know your position. मैं कौन सी क्लास में हूं पहले वो तो समझो आप, मुझे भी समझने दो आपको क्या आता है. And that can be learned only by asking questions. Ramana Maharishi, a great Indian saint, said, you can become enlightened by only asking one question, who am I? So I tell you, instead of asking me, who am I? What MK Shastri is, you ask your technical doubts and questions. You see, he asked about tongue. Tongue said, reaction nerve, depth of the nerve, and diagnosis. He used to see the palm and you analyze which area of the organ is deficient. Accordingly, you use points, and then he record patients. Definitely, I'll give you all these formulas very easily. I'm not going to teach you palmar diagnosis and all because it is not possible for you to learn over Zoom. Because you know how Master Tung disciples, they used to stay with him for years. They used to learn. Things can be learned on the patient. Practicals have to be done. Theory is okay. थ्योरी तो कोई भी बता देगा, ऐसा कर दो वैसा कर दो, ये नीडल ऐसे घुसा दो और दाएं से निकालो बाएं से घुसा दो. पेशेंट रिकवर हो गया क्या? दर्द कम हुआ है, रिकवर हो गया क्या? नर्व पर जो प्रेशर था वो रिलीज हुआ क्या? पेशेंट का कमेंट क्या है? व्हाट इज पेशेंट स्पीकिंग? See, I have to speak both in Hindi and English. I'm first speaking in English, then I'm speaking in Hindi. And this is not the class, it is an interaction. I just want to see who are my best students whom I can teach separately. I want to bifurcate the class, fellowship class, revision class, and my class. I'm looking for my students. I don't bother how much intelligence you have. I just want to see how much sincere you are. And I calculate your sincerity from Facebook and WhatsApp. How many people have shared my videos? How many are seeing my Facebook videos? How many are helping me? How many are running? How many are dedicatedly doing? I only found one person. Yes, please. I only found one person. Who? Any. Prakash Jain. But Prakash Jain has become too old to do all these procedures. But I found only one person among my 10,000 students. To be sincerely working is who? Any. I don't even know her face. I don't even know who she is. But I only know her name. She said she met me in Indonesia. But if you see, I blindly believe her because she manages all my WhatsApp group, all my work she does. Mickey and Annie, two Indonesians. I don't know why Indians do not manage. What are they doing? How much they have interest? Mobile is with them. Why can't they spread knowledge? Knowledge is something which is pure and enlightened. And when you practice it, you will really enjoy. You will really enjoy how to work with a CP child, how to work with autism at the same time, how to relieve a genetic child, how to change the morphology of the brain by subcutaneous needling, and that also dry needling. That was the question which was asked by a neurosurgeon to me. And I said, you see, the changes of the patient. Ask the patient what treatment I did, what medicine did I give. And you also know as a neurosurgeon, it has nothing to do with this patient. And he said, I'm amazed.
Sir, can I ask you a question, sir?
Definitely ask question. Introduce yourself and ask question.
Sir, I am Saurabh Ghosh, sir, from India, sir.
Oh,
Physiotherapist.
Ghoshi, हाँ, Ghoshi, बोले.
Sir,
Yes.
I have seen your videos even in practical sessions also. So sometimes you have done in brain stimulation through dry needle and sometimes without dry needle, sir. So what is the difference for doing this, sir?
See, I am an expert of brain stimulation. But to start with, you must start with 4 pins, 5 pins. Each pin has its own frequency. This frequency tells you if you stimulate this area with the spinal pain, the spinal nerves, the spinal area gets stimulated because this area of the brain was meant for spinal part. That required particular frequency. This required particular frequency for muscles. This required for particularly for brain and muscle spasticity. Why 80% of the people don't learn anything in my seminar? Because they don't come to learn. They don't want to operate a clinic called stroke clinic or neuro clinic. They just come to take one certificate and write that, put it in the board and cheat the people with that certificate. Putting a needle with my hand, I apply certain force. You see, I put a needle like this, I apply a force and I stimulate with a particular force. And a membrane and action potential is generated and a unified chain of command is take place. इनका सवाल था मुझसे कि मैं कभी पेन से करता हूँ, कभी हाथ से करता हूँ. मैं बोलता हूँ जो फोर्स अप्लाई जो मैं करता हूँ, जिस तरह से नीडल घुसाता हूँ और अप्लाई करता हूँ और जैसे घुमाता हूँ, उसी से मेरा काम हो जाता है.
Sir,
Because you cannot say, because you have to stimulate the brain. You are a primary student, so you need pain to stimulate. When you become a senior student, you can stimulate by your hands. Without purchasing pain. That is why I divided my class into 2 parts. Can you hear me? Hello.
Yes, sir.
Yes, sir.
Hello.
Yes, sir. Yes,
Hello,
sir. We
can
can
you hear
hear
me?
You can hear, sir.
Yes, sir.
एक मिनट रुक जाओ. Internet. Can you hear me?
Yes, sir.
Yes, sastri ji.
Can you hear me?
Yes, sir.
Yes, sir.
Am I clear, loud and clear, or this
Yes,
voice
sir.
is cutting?
Yes, sir.
So see, brain has billions of signals. How much?
Billions.
Billions of
Signals.
signals. Yes, billions of neurons generate billions of signals.
Audio is not clear.
How will you generate that signal which recovers the patient? My answer is, how many neurons are in the brain?
Billions, sir.
So how will you generate that signal which recovers the brain? By stimulator and
Needle.
what?
So needle,
Needle.
stimulator, and frequency of the stimulation.
Yes, correct. Frequency, needle, and pain. To prove myself correct, I am buying a very costly device from United States, RTMS, repeated transcranial magnetic stimulation of 2 coils, and direct transcranial stimulation. And then you can see in my clinic, come and check how the patient recovers. And that is why I laugh. You relieve the pain and you think the patient is recovered. While recovery I have seen in chronic cases, most of the people they take the worst symptom. आपका कोई स्टूडेंट है जो मेरे पेशेंट को रिकवर कर सकता है? You are giving a most complicated disease to a new person. You see. He does not know anything about brain mapping and he written, one person came from Mangalore. He has written in the certificate, I can recover all this disease, autism, autism and all in just 5 days. Putting my certificate, my picture in his Facebook. And even he went to the extent of writing eminent neurosurgeon. I never used the word eminent neurosurgeon. Recovery is easy only when you understand how to recover. किसी patient को ठीक करने के लिए first understand what is the disease and what are the procedures to be involved in recovery of the disease. Or else you are what? An assistant. I prick the needle, just put the needle. Put the machine. You cannot be a physician. Physician means individual, independent thought. Write down. What do you mean by physician? Individual, independent thought of analysis, which you develop for the recovery of the patient. यानी आपकी सोच जो patient को recover करती है. Now you cannot say in this modern world the heat of the spleen or the heat of the liver is created. You must see the modern terminology and bring this to traditional terminology. So fellowship will be what? About what? Modern medical science. I'm not going to teach you much about acupuncture here. It was very clearly said. Revision means about acupuncture. There will be many topics. Tung, tang, tan, I Ching. What is the difference between different types of acupuncture techniques? But that all depends on how much you understand. I can teach you 2000 things, but how much will you understand? So that will feedback I'll get from your questions. What is the level of your knowledge and how much you should get. Teach MBBS first student the syllabus of DM, super specialization. You will run away from the class. On the first day, I'll say, this is a pituitary injection, put it. You will run away. Oh, sir, nakko baba. कुछ हो गया अंदर में, पेशेंट मर जाएगा. अरे, go by good things. First, enjoy the subject. People said, Mr. Is it fellowship class or something? I said, no. It's an interactive class. First, let us talk each other. Who are you and who am I? Let us spend some time together. Let us not have over expectations. Don't think I'm becoming MK Shastri. You need 34 years to in a only closed room. You have to live. If you fell down in the washroom, just sleep in the washroom because there is no one to come and pick you up. So ask questions. Time is also going. Why to waste? Keep asking questions. Almost 9:33. Will just take 30 more minutes.
Sir, I am Nasir from Bangladesh, sir. May I ask you a question, sir?
You are definitely allowed to ask question. I said you to ask questions, so ask question.
Thank you, sir, for giving me the opportunity. After affecting by COVID before
Perhaps you are
8 months ago, I have diagnosed with type 2 diabetes, and I am losing weight more than 8 kgs in 8 months.
Your voice is not clear. You wait for 5 minutes. When your internet becomes clear, 1 minute.
Okay, sir.
Sir, should I repeat his question, sir?
Me? Can you hear me?
Yes, sir. Now,
Yes, sir. Can I, will I repeat the question? Someone asked.
Yes. Repeat the question, please.
Sir, how can I reverse the type 2 diabetes naturally without drugs, sir?
By procedures, you must know. You must know the entire anatomy of pancreas. You must know entire way how insulin is produced. You must understand how much insulin is produced by pancreas. You must know how to stimulate the beta cells.
Yes,
You must
sir.
know. You must be endocrinologist. You must study endocrine.
Yes, sir.
In TCM also they have written TCM endocrinology.
Yes, sir.
Without learning anything about the disease, how pancreas, how glucose, the role of insulin in the glucose, conversion into energy. What is the role of insulin, alpha cell, beta cells? Without knowing the details, what can you do? Huh?
Yes, sir.
So we will teach you all those things. Don't worry about all this. That is why fellowship class is there.
नॉन मेडिकल बैकग्राउंड्स वाला आल्सो ऐड कर सकते हैं सर उसमें?
सबको ऐड करो. मैंने किसको मना किया है? सर्टिफिकेट में पार्टिसिपेंट सर्टिफिकेट दे देंगे, खत्म हो गया बस.
नहीं, कल का दिन को कुछ भी
सीधी
प्रैक्टिस करे
चीजें
तो
मत
टाइम पे.
लिखना
जी सर.
कि मैंने मैं इपिलिप्सी ठीक कर सकता हूँ. नहीं 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 नहीं. देखिए, गवर्नमेंट इज गोइंग बाय रूल्स. दे आर वेरी स्ट्रिक्ट इन इंडिया. आप कुछ भी लिखो, फेसबुक पर भी आप उल्टा सीधा लिखो. हेलो, कैन यू हियर मी?
yes, sir.
Can you hear me?
Yes, sir.
Even before writing anything in Facebook, you should be very clear. You are under IT rules. You will be immediately booked and put to jail. You are taking a participant certificate and you must know what you can do and what you cannot do. See, if you have learned properly everything, today what would have been your growth? I started my practice 5 months back in Hyderabad. Today I have more than 100 patients. I started own established center and we have booked a place of 200-bed hospital.
वही नॉन मेडिकल वाला कैसे कर सकते सर?
नॉन मेडिकल वाला ऐसे कर सकता है कि फिर हम लोग तो वापस एनाटॉमी फिजियोलॉजी ये सब पढ़ेंगे ना. आपको कॉम्प्लिकेटेड नहीं मेरी बात समझिए. नहीं मेरी बात समझिए. एनाटॉमी फिजियोलॉजी ये सब जब चालू करेंगे फेलोशिप में, लिखा है मैंने, एनाटॉमी फिजियोलॉजी सब पढ़ेंगे. आपको कॉम्प्लिकेटेड डिजीज क्यों लेना है? आप साधारण बीमारियां ले लो जो कर सकते हैं. एक बीमारी तो नहीं है, हजारों बीमारियां हैं। अब सर दर्द ले लो, अब साइनस ले लो जो आप ठीक कर सकते हो। झमेले
जी
में क्यों जाना है?
करेक्ट।
अरे हम बैठे हैं ना, आप क्यों बैठे हो झमेले के पालने के लिए? इज आस्किंग मी, who wants to, why are you be trouble creator for yourself? We are already troubleshooters. आपको सीखना वो इजी टेक्निक्स बता देंगे जिससे आपका मन लगा रहे, रिटायर्ड लाइफ अच्छे से चली जाए, क्लिनिक टाइम कुछ कमाई हो जाए, टाइम पास हो जाए। But don't try to claim that I can recover cancer, I can do this, I've learned this, like that person, that I can recover autism. I've learned from MK Shastri, see his videos. I'm as good as MK Shastri. That is why I'm afraid of teaching non-medicals, because they do not know their limitations. Limitations means what? You can do something of what even the best neurologists cannot do anything about autism, and you have written big, big sentences about that. Only to advertise about yourself and earning some money and cheating the people.
Sir, may I ask a question?
Did I stop you from asking question?
Oh, no, sir, but definitely asking your permission. I'm Venugopal from India. One question is, you said that fellowship is basically talking about the procedures and other things.
No,
And
no. I never said fellowship is about procedures.
revision will talk about the acupuncture portion. Sorry, sir.
1 minute. Very clearly, let me tell you.
Yes, sir.
Let me make you very clearly. Fellowship is for medical people, those who are already have a medical degree. You will be given a participant certificate, those who have non-medical degree. Number one. Fellowship means what? You know much deeper about a subject. It's a training.
Right, sir.
Fellowship is nothing but a training.
Right, sir.
We call it fellowship training. Like I have done MCH, right? Or I have done DM. Further training done in what? Epilepsy and movement disorders. Means I have learned, I become more expert of what? This. Neurology is a vast field. In neurology, what is my expertise for this? This type of course is generated just to make you understand what is medical terminology. What is spondylitis, what is sleep disc, how is nerve impinged, how surgeries are done, what is cardiology, how ECG is done, how do you understand ECG. Little bit you will understand something so that you can understand where you will not go wrong. You must not consider chest pain as a gastric pain. What do you think about Rajesh, one of my friend, who always used to help me, famous in our circle, you do not know. He had a cardiac arrest. But since we understood it's a cardiac arrest, we could save his life. But if you would have taken it as chest pain, he would have died that night itself. So chest pain and cardiac pain and gastric pain has to be identified. For that, you must have a further knowledge of the subject. We'll start with what? Anatomy, physiology. Then YouTube is there, na? You study about more significantly. But पढ़ते जाओगे, सीखते जाओगे, you will learn it. Within 1 year, you learn so many things. Instead of watching movies, watch these movies.
So
Instead of watching Shah Rukh Khan, watch anatomy and physiology movies. Attend lectures of many people who have given what notes of PG. You will see in YouTube. Many people have prepared MBBS students for PG exams, right? and they have given lectures on anatomy and physiology. So if you read those lectures, then in other professors are there. So if you continue your studies, not only with me, with other people, online lectures, other things, what will you happen?
The foundation
You
becomes
become
very
an
strong.
expert in 2 years because you know what you need to do, you do what you cannot do. First, you must know what you can do, what you cannot do. Foundation means what? Your general knowledge about the subject is strong. You must be able to identify what you are doing. यानी आपको आइडेंटिफाई करना है कि आप क्या कर रहे हैं और क्यों कर रहे हैं और इससे क्या होगा. For example, an extruded disc comes to me. Immediately I'd say Papa 1, Papa 2, Papa 5, Papa 4. These are the name of my injections. Then they will say, sir, Mummy, Dada, Dadi. No, no Dada required, no Dadi required. I made my combinations with what? Centrifugal machines. I combined salines. I centrifuge it and I use it. And I saw they produce anti-inflammatory effect, instant anti-inflammatory effect. And what did I name them? Papa, Mummy, Dada, Dadi. Papa 1, Papa 2, Papa 3. I have Papa 15. Give me Papa 5, Papa 4. This is how we use in our clinic. Words. They used to get confused what to do. So I used to prepare the medicine and I used to name them what, Dr. Mohan Singh, who was like my father. Papa 1, Papa 2, Papa 3, Papa 4, Papa 5. Now very easy for me. Give me Papa 5, 3, Papa 2, 1, Papa 1, 5. Many mnemonics. So similar way, you can learn many mnemonics of understand cranial nerve, how to go. When you understand the anatomy clearly, physiology clearly, then you can understand about the disease very nicely. Then you can understand the grading of the disease, then you can understand the stages of the disease. And when it is coming down, you can understand how much trouble the patient will face. When you are reversing diabetes, what will happen in the patient? Hypoglycemia, reduction of dose, regular checkup, alerting the attendant, getting alert. All these things you must know. Not just reversing diabetes, you must know everything about what? About the disease. About the awareness. That is what I say, awareness of the disease. You must create awareness in the mind of the attendant, in the patient and people.
Thank you, sir.
Because if you create awareness, then you do marketing. If you do awareness, you create safety. If you do awareness, you make money. So you must learn awareness. Awareness teaches you 3 things. Be aware. Why? Because if you are aware, you will never make mistake. It saves you from legal problem. Can you hear me?
Yes, sir.
Yes, sir.
Yes, Sastri.
Second thing, be aware because you have to create awareness. You must be able to answer all the questions of the people who ask you. Third, you must know how to stimulate the brain. Without brain stimulation, nothing is possible. I always see all the cases of neurology, neurosurgeries, especially in neurosurgeries, not successful. After not because आपके पास कुछ भी नहीं है जिसे स्टिमुलेट कर सके. Can you buy 28 lakh rupees, 30 lakh rupees device, RTMS, repeated transcranial magnetic stimulation? Can you buy that? जब आपके पास स्टिमुलेटर नहीं है, कुछ नहीं है, नीडल नहीं है, तो फिर क्या एक्यूपंक्चर प्रैक्टिस करेंगे? उसी तरह if your clinic does not have a setup, we call it clinic setup. What did I do? I made a setup here. I created team, nurse, documentation. I'm buying CM. I'm buying microscope to study more about brain. What does it mean? It is called setup.
Thank you, sir.
Understood? You must learn first what is your infrastructure. आपके पास क्या क्या सामान चाहिए जिससे पेशेंट रिकवर होगा. पहले इंफ्रास्ट्रक्चर बनाओ. आप लोग क्या करते हैं? वो टेंस मशीन टेंस. मैंने तो एक ही चीज देखा, न्यूरोसर्जन को भी प्रिस्क्रिप्शन में एक ही चीज लिखते हुए देखता है, IFT टेंस और क्या है भाई? What is a machine? IFT टेंस and
Ultrasound.
ultrasound. No. A neurologist will write one IFT tense and
Stimulation.
Muscle
very famous word
stimulator.
of them. No,
Mm.
they don't write muscle
Muscle
stimulator.
stimulator.
muscle stimulator.
No.
Traction.
No, the
Short wave
neurosurgeon will
action.
never write traction. IFT tense.
SWD.
Huh?
SWD. SWD.
Something like KWD is in acupuncture. No. Some physiotherapists will say, what does neurologist write? A orthopedic surgeon write. So what does they write? Tense.
Exercise.
IFT.
That exercise they will never write. They only write IFT, tense,
IF, ROM.
Rome and all is. See, that is what I say. You are saying about the movement. They never write about Rome. They only write three things. Neurosurgeon will write only electrotherapy. IFT, tense, and one more will write. I forgot the name. They also don't know what to write. So they write these three. I asked them, on what basis did you write this? We know this
Sorry.
three, so we write.
EPM.
Huh?
EPM.
पता नहीं, मैंने तो ये प्रिस्क्रिप्शन में नहीं देखा. IFT टेंस और एक और मशीन देखा, पता नहीं. एक ही चीज देखता है सारा न्यूरोसर्जन, ये लिख के देखता है. And if you use this machine, do you know what is the utility of this machine? On this disease, post-surgically, how much damage it will do? So if you don't know, why do you write instructions on that? You are a neurosurgeon, your work is to do neurosurgery, very correct. You have a perfect neurosurgeon. But when you do not know how to revive this situation which has been created now, so don't give further instruction on that issue. Let the one who can do this, refer it to him. This is what we all do in medical science. If I don't know anything about diabetes, I just refer it to a diabetologist. If there is a brain tumor, we refer it to a neurosurgeon. If there is a continuous epilepsy, we refer it to a neurosurgeon, neurologist.
Do the needful.
See,
Referring.
do the needful means refer to neurologist for the needful. What do we write? To the consultant, neurology, sir, we are referring this patient. At the diagnosis of the patient, let him think and let him do, because he is making money out of it. It is his duty, not my duty to diagnose. I am not a neurologist to diagnose. Again, yes, sir, I am referring a patient of tongue clonic seizure. You do this. And maximum neurosurgeons have stopped this. Because there are some people who can question them, and we are the one who question them. Very nicely we question them. And I question everyone that how will it recover the patient, sir? I'm asking you a question, fundamental question. You are a teacher, please teach. Sastri, we know this much only. So we need to study more. If you don't know, please refer to those people whom you believe who can recover the patient. Please refer that patient to that patient. आपको नहीं आता है, कोई बात नहीं. आप उसके पास जाइए और उसको रेफर कीजिए And if you have time, come and learn. Many times from me, how I revive neural paralysis patient by inserting needles. I've taught many times to neurosurgeons. Udipong practices neurosurgery, acupuncture with neurosurgery in Thailand, Pusat Institute of Neuroscience. Udipong बोल के जो न्यूरोसर्जन है वो पुसात में एक्यूपंचर प्रैक्टिस करता है. ऐसी कोई बात नहीं है. ईएनटी इस बार मेरे पास ऑर्थोपेडिक सर्जन आ रहे हैं, ईएनटी सर्जन आ रहे हैं एक्यूपंचर पढ़ने इस सेमिनार में. दूध का दूध पानी का पानी हो जाएगा. इफ आई राइट, आई एम राइट और रॉन्ग. मैं एक ऑर्थोपेडिक सर्जन को तो टोपी नहीं दे सकता. ये सीन में hundreds of videos. I'm teaching whom? I'm practicing with whom? Cardiac anesthesiologist, who is the head of the department of what? Manipal Medical College. Can I make him fool? I'm practicing with whom? MD medicine, with 10 years of experience, 12 years of experience. In 2 minutes they will catch me, catch my knowledge. Sastri, this is the problem. That day, a patient came in the ambulance all the way from there. Immediately in the car, I saw the patient is dead. Before bringing the patient in my center, immediately I went in the ambulance. I declared the patient dead there. Then I brought inside. We worked for 3 hours. We could not sustain him. But we could sustain another Parkinson's patient who was about to die because we had sufficient knowledge. We did not refer it to ICU. Whole night we were sitting there. We gave him atropine, one dose of adrenaline. His cardiac and heartbeat कम हो चुका था, 46 पे जा चुका था. ये SPO was below 30. We revived him in 1 night. Now he's good. तो इसलिए बेटा थ्योरी प्रैक्टिकल एक लंबा सा विषय है. ये इट्स अ लॉन्ग सब्जेक्ट. इन चाइना इट इज taught for 5.5 years. I don't know how you become acupuncturist in 10 days. You can learn some system of it and apply with it. But education is a continuous process of reconstruction of your experience. यानी आपके जो अनुभव है उसको और बढ़ाइए, अच्छे से करिए, अच्छे से प्रैक्टिस कीजिए ताकि आपका नाम, आपका यश, आपकी प्रैक्टिस और बढ़ जाए. नहीं तो नाम जब बदनाम होगा तो सब कोई नहीं आएगा. ना मेरी क्लिनिक के आगे कोई नाम लिखा हुआ है, ना मेरे क्लिनिक के आगे इंस्टीट्यूट ऑफ न्यूरोसाइंस लिखा हुआ है, ना मेरे क्लिनिक के आगे एमके शास्त्री लिखा हुआ है, ना मेरे क्लिनिक के रूम के आगे एमके शास्त्री लिखा हुआ है. But I deal with what? More than 100 patients a day. Today, a patient came from Gujarat all the way to be treated. Where is Hyderabad? Where is Gujarat? You see, a remote part. They came for the treatment. So what do you want? It has to be decided. पहले ये डिसाइड कीजिए आपको क्या बनना है. To become a specialist, you have to study like a specialist. Like you have to study MBBS, then MD. That means you have to continue your studies. Even today we study because we get so much complications in a patient that we still study. Every night there is a discussion with this one. Ask questions. We're about to go. अरे 10 बज गए भाई. Last question of the day.
Good evening, sir.
हाँ.
Sir, I am Nilima from India.
हाँ Nilima. Your basic qualification?
Sir, I am BNYS.
Acha, any of BNYS male, not female, male, BAMS or MBBS wants to join my clinic with salary, they can apply. A vacancy has been opened. You may please share it in your group.
Okay, sir. Yes, sir.
You are having many WhatsApp group, I suppose.
Yes, sir. I have few groups.
Yeah, I have already pasted the advertisement in my group. You please paste it. One Aditya Khare has applied. He is also my old student. So let me see.
Okay. Yes, sir. I'll do it definitely, sir.
Very good. But if you do it, I'll give you something extra. Remember, I'm ocean of knowledge.
Yes, sir.
So ask me your question, my sweet daughter.
Sir, can we treat SLE patient, like can we recover him fully?
Beta, SLE is an autoimmune disease. No
Yes.
one can recover it. You can revive the patient with the symptoms of SLE. That's all what we can do.
Okay, sir.
With the help of acupuncture and conservative treatment. Never stop steroids and all, because it will create complication. If steroids have created complications, then let the conservatively let them manage it. You do your role, let them do their role. Don't mix your role with their role, right, beta?
Yes, sir. Okay, sir.
Because SLE needs steroids, right?
Okay.
This is what we know. Because what do in Rome as Romans do. You know this proverb?
No, sir.
Do in Rome as Romans do. And in Rome में वही करो जो Romans करते हैं. मंदिर में जाके घंटा बजाया जाता है. मंदिर में जाके नमाज अदा करोगे तो डंडा पड़ेगा. You understood?
Yes, sir.
Similarly, in SLE, you have to go by the system of the procedure of the treatment. Let the allopathic continue their medicines along with conservative, what you can do to release the patient. Once the patient starts recovery, medicines can be tapered and then it can be withdrawn. But all of a sudden, decisions should not be taken. Clear?
Okay, sir. Sir, I have a patient but she is telling that she has burning feet. So can we do something for that?
You can do, but you do whatever you can do, because you do not know the procedure to recover paresthesia, because the myelin sheath of the nerve is damaged. It is called paresthesia, right? Now
Yes,
the
sir.
paresthesia has been developed because of local, or there is a motor neuroma. There is a cyst which develops in between the fingers of the feet, or it is because of the S1 nerve compression or S2 nerve compression. So we have to identify the cause of the disease. According to identification, definitely we can do. But first, you must know what to do.
Yes, sir. Sir, she is taking lot of medicines. So is it because of some medicine?
See, medicines have side effects, but now it is very difficult at this moment to know, to diagnose the disease, because SLE patient is an autoimmune disease, and how much autoimmunity, because these medications cannot recover the patient. Patient will continue to progress his disease. Medicine has supported the patient. You understood?
Yes, sir.
It's a progressive disease, right?
Yes, sir.
So medicines has a limited role. They can do something, but they cannot cure it. It's not an infection. It's an autoimmune disease. You must classify the disease into two parts: communicable, non-communicable.
Yes, sir.
So how many of you, last thing, how many of you have registered for my revision course in acupuncture, which costs 8,500 rupees? How many are interested?
Sir, I am interested.
I am interested, sir.
I'm interested, sir.
And how many?
Me too.
So,
Interested,
only 3
sir.
more people.
I
Very
am
good.
interested, sir.
So those who are interested for seminar, they can, fellowship course is always free. Medical knowledge is always free for others. We will give you some insight of topics, but we'll continue to interact first with 5 to 10 days because there's various people from various countries, Nigerians, these. So when you ask me questions, I understand the level of your knowledge. And according to that, I will have to prepare myself. यानी आप लोग की knowledge के हिसाब से मुझे आगे बढ़ना होगा. You are learning something from a super specialist about basic subject. आप लोगों को पढ़ाना और एक basic knowledge पढ़ाना एक बराबर है. यानी आप प्रिंसिपल ऑफ द यूनिवर्सिटी, वाइस चांसलर ऑफ द यूनिवर्सिटी से क्लास नर्सरी में पढ़ाने की बात कर रहे हैं. And then I think that I'm teaching my grandson. One of my friends was a vice chancellor. I said, sir, what are you doing these days? I'm teaching ABCD. Oh, very good, sir. You become a student of class nursery. Yes. After being a vice chancellor, I thought of I should sit and start class nursery.
Sir, can I ask you?
It was similar with the chief of DRDO, Christopher. I said, sir, after retirement, what are you doing? ABCD and Jack and Jill. So,
Sir,
instead
one
of wasting
question.
your talent,
Can I ask you?
yes, wasting of talent, use your talent for good work.
Sir, can I ask you one more thing, sir?
Yes, you ask.
Sir, actually, there is a patient who is my relative, sir. So I am just discussing with you, sir. He is having chronic pancreatitis due to multiple calculi in the pancreas, sir. Non-alcoholic, sir, and non-smoker. And this is from
necrotizing pancreatitis.
no, sir, not necrotizing pancreatitis. According to AIG, sir, last time I went to AIG, so they told that it is chronic pancreatitis. It is, and he is suffering from last 15 to 18 years. With sir, recently have last 3 to 4 years ago, he has diagnosed with heart failure with ejection fraction 21 to 24%. With some there is some kidney issues also.
Can I
And
give you one beautiful advice?
sir,
Can I give you one beautiful advice?
sir.
You want to enjoy with your wife, or you want to create a headache for yourself?
Sir, I want to headache. I want to take headaches, sir, just because he is my brother-in-law, sir, my sister's husband.
What can be done with this patient when they do not understand? At the beginning of the disease, nothing was done. At the terminal stage of the disease, what can be done?
So that's why I am, sir, consulting with you, sir.
What can I do? It requires a lot of brain stimulation, lot of. Even if you revive, what you would revive? Already things are damaged. डैमेज से वापस रिकवरी करना बहुत मुश्किल है. इतना पेशेंस कहाँ है आदमी के पास? 6 महीने सेंटर में रहना, ये करना, वो करना, छोरा पारबो ना तो. Grade 1, grade 2 diseases are okay. Grade 3 is okay. Spinal cord injury, neuro diseases are okay. They recover. But this endocrine disease is very difficult to recover.
So can I ask you one question?
Acharya ji.
Yes, sir. So actually, I want to talk about hydrocephalus. Hydrocephalus.
Hydrocephalus.
Can it be cured?
No one can cure hydrocephalus. Event is established. Event is implanted in the brain, and then you have to recover the delayed milestone of the child through brain stimulation. This is what I do. I am saying what I do. I insert few needles and I try to revive the patient. Hydrocephalus is a situation in which the fluid is accumulated in the brain, and it will damage the brain by shifting the midline. So a vent is applied because choroid plexus is producing lateral ventricles of choroid plexus, which produces excess of CSF. वो hydrocephalus पैदा करता है. यानी ventricle से CSF निकलता है और स्वेलिंग होता है ब्रेन के अंदर, यानी पानी भर जाता है। तो उस पानी को निकालने का एक तरीका होता है जो न्यूरोसर्जिकल प्रोसीजर बोलते हैं, वेंट लगाना। वो वेंट लगाने के बाद अब जो नुकसान हुआ है उसके बाद का नुकसान आप ठीक कर सकते हैं, यानी आफ्टर दैट वॉट एवर लॉस वाज डन, delayed milestone has to be recovered and the child will recover.
So actually, so VP stunt, after the placing of VP stunt, there are some complications, right?
What are
Breakage
the
of stunt.
complications they have?
So like infection and breakage of stunt.
Then the neurosurgeon has to be reconsulted. Who is your
So
neurosurgeon?
it has to be done again and again. The surgery has to be done again and again.
No, who is the neurosurgeon?
So the neurosurgeon is Madhav, Dr. Madhav,
Mother
Manish
from?
Madhav. He's from Siliguri.
See, what did I tell you? Writing neurosurgery is not enough. When you are taking complicated cases, you must deal with people like IP Cherian or Lakshmi Nath.
Okay, sir.
You understood?
Yes, sir.
I've seen young people, they just pass out MCH and they spoil all the cases of neurosurgeries. So whenever there is a complicated case, you must meet a senior neurosurgeon, including IP Cherian, Lakshmi Nath, who are competent enough, who have 15 years, 20 years of experience, who are doing teaching in neurosurgery, who are examiners of neurosurgeon. Go to them. They will give you the right advice. If you want Dr. Lakshmi Nath's number, I'll give you. Talk to him. Give him my reference. Is our medical director. And also only one family member I have. Because when I wrote the word orphan, Lakshmi Nath got so emotionally involved. He's a senior and chief consultant of Continental Hospital in Hyderabad, a very big hospital. He wrote me, "You are not orphan, sir. You are the part of my family. So being my family member, you write to him.
Yes, sir.
He'll definitely help you. Dr. IP Chedian is there. We have a competent team of neurosurgeons. Don't worry. If you have any neurosurgical cases, you please speak to us. We'll get it at the very minimum cost and you will get the best neurosurgical help. Right?
Yes. Thank you so much, sir.
Why to thank you? It is my duty.
That's even though you suggested me.
I have to give you right suggestion. You asked me a suggestion now.
Yes, sir.
Why when it is getting reinfected? Take second opinion. Send his documents. अगर documents भेजने में कितना time लगता है? Send it to WhatsApp. Talk to a doctor. Come to a conclusion. Visit him. Siliguri to Hyderabad, 2 hours visit. Then talk to him what can be done. Is from CMCH Vellore, Christian Medical College Hospital Vellore. You know why I respect Lakshmi Nath? Because there is only one seat in MCH, in CMC Vellore. IP Cherian has passed out of 20,000 students, only one person get that seat, right?
Yes,
30,000 students appear for that seat and only one get that seat. And they are those genius. Nikunj Mittal, Lakshmi Nath, IP Cherian. You should know from which college they have passed out.
Yes, sir.
See their profile. There are hundreds of neurosurgeons, but see, if it is reinfecting, take second opinion. What is the problem? I'm not criticizing your doctor, but why it is happening? What can be done? What are the latest equipments which may not be available in Siliguri? But you can see, IP Cherian has invested more than 200 crores in Karat. Continental Hospital has spent around 50 crores. But they're the best part of these doctors are they're like me. You know, na, a friend is known by the companion he keeps. एक दोस्त उसी तरह से जानता है जिसके दोस्त जैसे जैसा वो वैसे उसके दोस्त. So these people are less greedy, more helpful. Talk to them. You give me a WhatsApp message. Please type in my number 8473814. I don't know my number. 8 or 6, I forget.
Yes, sir.
What is my phone number? Hey, what is my phone number?
Sir,
Not you. Others must have.
Sir, 847
847.
You write down and give
381.
him.
so
Right.
it's 473814247.
No. You write and give. Don't shout. Right? In the chat box.
Okay.
So I've sent you a message. I sent you a message yesterday regarding this.
Again, you have to send it.
Yes,
because
sir,
I
sir.
get 100, 500 messages in a day. How many?
1,500 messages. I'll just send you.
I reply only 100 messages. 400 messages I surpass.
Thank you, sir.
How can I reply 500 messages? Where do I have time?
Sir,
But your question, I'll give you the number of Dr.
any...
Lakshminath. I'll just give you the number of Dr. Lakshminath. You talk to him and give him, tell him that your brother has referred this case, M.K. Sastri.
So,
He texts me as
what
his
message
brother.
should I leave you, sir? A special contact like you would reply me.
Huh?
So what message would I leave so that you would reply me?
Sir, I need the number of Dr. Lakshminath because of this case. So we have very competent team of Dr. I.P. Cherians, Dr. Lakshminath. They're the examiners of neurosurgeons. They're competent neurosurgeons. They're passed from the best medical college of India. You can, if I can believe them, that means you can understand. I closely believe them. That means they're really good. Nikunj, because they have passed out with 20,000 students appear for one seat. 30,000 students appear for one seat. Ramesh Kumar, don't come in the very certain class. Have a cert when you come in the class. गंज में आने की जरूरत नहीं है क्लास में. More questions? So I'm going. We'll have more interactive classes so that you can learn more about me. Then we'll start. Because some people want refunds. So before I start the class, you take your refund also, you do everything. And those who want to pay the money, they pay money. For revision acupuncture classes, class is different. This is medical, that is acupuncture. Don't mix two things at a time. I don't like too much mocktails and cocktails. In alcohol, it is said, take only one brand at a time. If you take black, what do you call it? Black label and red label and whiskey and vodka, day after tomorrow you will have what? Good hangover. So, in fellowship class, medical subjects will be discussed. Acupuncture classes will discuss about acupuncture. We have finally analyzed it very clearly. Those who are medically qualified, they'll get fellowship. Those who are not medically qualified, they'll get participant certificate. That's all. Knowledge is important. Degree is not important. You can take out one certificate from your what? Printer and put it in your wall. Who is going to ask you? I never put any certificate. I never suffix anything after my name. I'm a very qualified physician, but I never write anything. Why? I don't need to write. I only write. You see my Facebook? Did I write my qualification?
Yes,
Some
sir.
people ask. I say this is my acupuncture qualification, diploma in acupuncture. Only one certificate I say, which gives me license. Why I need to show so many certificates? My knowledge is my certificate. If you believe me, come. If you don't believe me, go. And I deal with the most critical cases. 2 lakh videos are there to certify what is my knowledge. I don't like hypocrisy. I'm not a hypocrite. I follow Bible. I don't want to be what?
Hypocrite.
Yes. Writing this many qualifications will not recover the patient. Recovery of the patient will speak what is your knowledge and what is your qualification.
Exactly, sir.
Those who are interested, they may please enroll for revision class. Those who are interested only for fellowship, remain in fellowship. Okay? Thank you so much. Good night.
Thank you, sir. Good night, sir.
Thank you, Sastriji.
Thank you, sir. Good night, sir.
Thank you, sir, and everyone.
Thank you.
Good night everyone. Selamat malam Pak Ahmadi.
Ya, selamat malam. Ya, terima kasih.
Thank you. With
Selamat
good
night.
night.
Thank you, sir.